project looked at the CAD Solus pump, a reusable ambulatory pump that delivers intravenous antibiotics instead of using a disposable elastomeric device. And that is basically a device that delivers antibiotics, but it's disposed of every day. We thought that by using a reusable pump rather than a disposable pump, we would be putting less pharmaceutical waste in for incineration. Not only are we saving greenhouse gas emissions, but we have found that we have an improved administration of the intravenous antibiotics. And that's really important because obviously better doses leads to better treatment, better patient outcomes.
I think that the CAD pumps have improved the patient experiences because we've really improved that medication delivery, not only for antibiotics, but also for fluids for hyperemesis patients. The CAD pumps help us to make our nursing visit runs more efficient, so we can see a patient once a day and have a 24-hour infusion instead of going out and doing a twice-a-day visit. We are implementing early hospital discharge or hospital avoidance altogether because we don't have to wait for the pump to be made up off-site. We make it up on-site and we don't have to wait for that delivery.
We really have the triple bottom line here. We've got better patient outcomes, faster patient discharges, patients like it. We've got reduced carbon emissions and we've got reduced drug costs.
The NWOW dashboard is a dashboard that has provided transparency and visibility over nationally weighted activity units, otherwise known as NWOWs, and all of that data and information that collectively educates and provides information around how we're tracking in terms of our performance.
NWOW stands for National Weighted Activity Unit. It's a unit of measure that's used within the Australian health sector to essentially weight activity between different services within different streams of a hospital or clinical service. So for example, something like a very standard admission that might be a couple of days would typically reflect 1 NWOW, whereas something like a simple clinic visit to an antenatal clinic for maternity services would represent something like a 0.5 NWOW.
The concept of NWOW performance reporting isn't new in itself. It's the collation of all of that information into one dashboard that's made it really easy to understand.
So with charts, visuals, targets, icons, numbers, it allows you to filter specifically for different services. If you're a director of service, you can filter for your directorate. And if you're chief executive, you can see the top view.
From our staff, we've had excellent feedback. It has that really good benefit for managers to be able to say where's the activity, how we're recording it, where are our gaps, how are we performing to target. I'd like to think it's the first in the state. We've had LHDs reach out to us to either have a look at the dashboard or to take the IP from it, which has been fantastic.
The name of the project is the Potassium Challenge. What we were trying to understand were the issues around potassium infusion, how often it was happening. Pain is a known consequence of potassium infusion, so we wanted to understand how the staff were managing the pain and what strategies they were using.
We looked at what is the alternative here and why are we giving so much IV potassium? And the outcome of that is that we probably don't need to. We're probably giving a lot and too much, and that there is not significant inferiority with giving oral potassium as well.
Since April 2024, we have identified there's been a 13% decrease in potassium distribution. I think this project has a positive impact for people, that being patients who are not delivered a painful therapy if they don't need it, staff who don't have to deliver a painful therapy, but it's also important for the planet because it is reducing the use of plastic, PVC and environmental waste.
Definitely a massive sustainability change. A huge amount of packaging used that is non-recyclable for when you're doing things with hanging IV potassium, including not just the bag, but also the lines, etc. However, then you also have to look at the cost benefits here. Huge cost discrepancy between both intravenous and oral potassium, with oral potassium being infinitely cheaper with just a few cents per tablet. I'm most proud of, obviously, this was a large team effort. And although, run and led phenomenally by Jackie, it really showed that we can engage the whole hospital, multiple different departments, and everyone was really invested in the project as a whole, came together and were really keen to help.